What if you never slept again? The horrifying truth about sleep deprivation and sleep apnea. Hello and welcome to the channel. Imagine this. One day you decide to stop sleeping. No naps, no power downs, not even a quick blink and doze during a boring meeting. Just you, fully awake, forever. Sounds like a productivity hack, right? More time to work, play, binge watch your favorite shows, including this one. But what actually happens to your body and brain if you never sleep again? Spoiler, it gets terrifying very quickly. In today's episode of Askadoc, we're diving into the disturbing science of sleep deprivation, how your mind unravels, your body breaks down, and why skipping sleep might actually kill you. This isn't just about pulling an all-nighter or being groggy at work. We're talking about what happens hour by hour, day by day, when you literally never sleep again. From hallucinations and paranoia to hormone chaos and brain damage, we'll walk you through what science tells us about what happens when sleep vanishes from your life. Stick around, because we're covering real-life cases, jaw-dropping studies, and some straight-up creepy science. But first, we have a new app. You can connect directly with me and ask away to your heart's content. Take a look at the app Askadoc for advice, personalized medical advice at your fingertips. If you have a burning question you don't want to post here, post it on the app and I shall do my best to answer it. So let's dive right in. Why do we need sleep actually? Before we dive into the horrors of no sleep, let's ask a basic question. Why do we even need it? Sleep is not just a way to reset or to rest. It's essential maintenance for your entire body. Think of it like a nightly tune-up. Your brain clears out waste products via something called the glymphatic system, which flushes out toxins like beta amyloid, a protein linked to Alzheimer's disease. Keep this in mind. We'll come back to this later. During sleep, your body repairs tissues, builds muscle, and regulates hormones. Growth hormone peaks during deep sleep. Your immune system also gets a reboot. Natural killer cells, which fight viruses and cancer, regenerate while you sleep. Sleep also consolidates memories. Ever wonder why pulling an all-nighter before a test makes everything blurry? That's because your brain doesn't have time to store what you learned. Lack of sleep affects everything: cognition, emotion, metabolism, and even your DNA. Yes, one study from the University of Surrey in the UK showed that just 1 week of sleeping fewer than 6 hours per night altered the expression of over 700 genes. So yeah, sleep is kind of a big deal. The first 24 hours without sleep. Okay, you now stayed up 24 hours. What happens? You're starting feeling slow. Your reaction time is impaired. Your ability to focus tanks. You become more impulsive and emotionally reactive. In fact, research shows that after 24 hours awake, your brain functions about as well as if you were legally drunk. Specifically, a blood alcohol level of 0.1%. Your brain's prefrontal cortex, the part responsible for logical thinking and decision-making, begins to underperform. Meanwhile, the amygdala, your fear and emotion center, goes into overdrive. That's why you feel more stressed and irritable. You might get a headache. Your body starts producing more cortisol, the stress hormone. Your glucose metabolism slows, making you feel hungrier and crave carbs. Sounds manageable? Just wait. Day 2 to 3, cognitive decline and weirdness. By the 48-hour mark, your body and mind are slipping into chaos. Your attention span becomes microscopic. You start to experience microsleeps, tiny episodes where your brain just shuts down for 1 to 30 seconds. You might not even notice them, but if you're driving, these can be deadly, of course. Your speech slurs, your memory fails, you become emotionally unstable, anxiety increases, and your senses all out of whack. Some people begin to hear faint sounds that aren't there. Basically, they become a little bit delusional. By 72 hours, the weirdness escalates. You may start hallucinating, seeing things that don't exist. Paranoia creeps in. Your sense of time gets distorted, and the longer you go, the worse it gets. Hormones go haywire. Testosterone plummets. Insulin sensitivity drops, meaning insulin resistance increases. Your immune system weakens dramatically. Cortisol, remember the stress hormone, continues to rise, which can eventually damage your brain's hippocampus, key for memory. You may still be awake, but your brain is losing its grip on reality. All of these symptoms, by the way, are typical of what we call psychosis. Basically, they are signs of schizophrenia. So, interesting, huh? Just 3 days into lack of sleep, and you're becoming schizophrenic. That's the reality of lack of sleep. Let that sink in. Days 4 to 7, full system breakdown. Welcome to the deep end. You are now entering the realm of extreme sleep deprivation, a place few have willingly visited. The most famous case is Randy Gardner, a 17-year-old who in 1964 stayed awake for 11 days as part of a science fair project. By day 4, Randy was paranoid. He couldn't concentrate. He thought he was a famous football player. By day 6, he was hallucinating. At one point, he believed a street sign was a person. You may experience derealization, feeling like the world around you isn't real. Your body temperature drops. Your heart rate becomes irregular. You can't think in full sentences. And it's not just your brain. Your gut health collapses also. You risk infection. Basically, the risk of infection skyrockets in rats. Complete sleep deprivation causes death in under 3 weeks due to immune failure and skin lesions. Your body is now basically starting to consume itself. Long-term effects of chronic sleep deprivation. Even if you're not pulling an 11-day marathon, chronic poor sleep still wrecks you. Regularly sleeping under 6 hours, let's say, is linked to obesity, type 2 diabetes, heart disease, stroke, and even certain cancers. Your risk of depression and anxiety increases dramatically. In the long term, poor sleep is a major risk factor for Alzheimer's. Now, remember we did talk earlier about the Alzheimer proteins. Now, the reason that sleep as a deprivation, as a poor sleep being a major risk factor for Alzheimer's, is that it's partly due to the glymphatic system that we mentioned above, which can't flush out harmful proteins without sleep. This is key. Sleep deprivation also messes with your metabolism. Your body becomes resistant to insulin. We've already mentioned this. You gain weight more easily. We've mentioned this. Your hunger hormones, ghrelin and leptin, go out of balance, making you crave sugar, and you eat more. And if you think caffeine solves the problem, think again. It masks the symptoms, but doesn't really fix the underlying brain fog and hormone imbalances. Even your appearance changes. Chronic poor sleep leads to puffy eyes, dull skin, and faster aging. Sleep isn't optional, it's survival. Can you die from no sleep? Technically, yes. There's a horrifying genetic condition called fatal familial insomnia, FFI. It usually hits in middle age, and sufferers lose the ability to sleep completely. Within months, they develop dementia, hallucinations, total insomnia, and eventually die. There is no cure, unfortunately. In animal studies, rats deprived of sleep for 2 weeks all died. The exact mechanism isn't fully understood, but it appears to be a total immune and metabolic collapse. In humans, it's hard to study because intentionally depriving someone of sleep to that extent is, of course, unethical. You will never get such a study. But experts agree, go long enough without sleep and your body will shut down permanently. Now let's look at some sleep myths versus facts. Myth: I'll catch up on sleep this weekend. Fact: you can't fully recover lost sleep. Some damage is irreversible. Myth: some people only need 4 hours sleep. Fact: less than 1% of people have the rare gene mutation DEC2 to thrive on 4 to 5 hours. You're probably not one of them. Myth: I fall asleep instantly, so I must be well rested. Fact: falling asleep too fast often means you're actually sleep deprived. How to sleep better tonight? Here are my personal tips for you. Stick to a sleep schedule, even at weekends. Certainly avoid caffeine after 2 p.m. Limit blue light exposure before bed. Use blue light filters or glasses if necessary. Keep your room cool and dark. Try a white noise machine or meditation apps to enhance good restful sleep. Avoid alcohol right before bed. It fragments sleep. But what if you do sleep okay, but your sleep is just inadequate? Welcome to the world of sleep apnea. Sleep apnea syndrome is a disorder in which your breathing repeatedly stops and starts during sleep. It's divided into 3 main types. Obstructive sleep apnea, which is the most common type, caused by a physical blockage of the airways, your breathing apparatus, usually when the throat muscles relax too much during sleep. And then you have central sleep apnea, which is less common, and this is caused by the brain failing to send proper signals to the muscles that control breathing during sleep. And then you have complex or mixed sleep apnea, which is a combination of the first 2 types. The word apnea literally means without breath. Each apnea episode can last from 10 seconds to over a minute and may occur hundreds of times per night. That's hundreds of moments where your brain is gasping for oxygen. This causes disrupted sleep, oxygen deprivation, and serious strain on the cardiovascular system. Untreated, it's a major risk factor for hypertension, atrial fibrillation, and irregular heartbeat that leads to stroke, diabetes, and even premature death. What are the warning signs of sleep apnea? So basically, how do you know if you or your partner? Remember, this is often a condition diagnosed by someone else, somebody close enough to you to be in a position to observe you during sleep. Loud, chronic snoring, that's the first one. And in fact, this is what usually brings spouses or partners to me, or GPs or lung specialists, who of course often deal with sleep apnea because it's ultimately a breathing problem, right? So pneumologists, lung doctors are often the specialists that are designated to deal with this. Choking or grasping for breath, gasping during sleep. Pauses in breathing observed by the partner or spouse. Morning headaches. There's a good reason for this. Basically, during these episodes of apnea, what happens is not only do you lack oxygen, but carbon dioxide, which is the gas that is expelled. I just made up a new word, expelled, which is expelled from your lungs, your respiratory system. That accumulates, of course, in your body if you don't have enough breathing actions. You're getting apnea episodes. So CO2, carbon dioxide, is retained, and that is toxic for the brain. And when you do wake up the next morning, you often get headaches. Dry mouth or sore throat on waking up. Daytime fatigue or sleepiness. Now, this is a major symptom that, again, often brings either the patient themselves or the partner to me. And very often, some people even appear before me when they've already had an accident whilst trying to drive to work because they're just too tired in the mornings. This is a tragic consequence of sleep apnea, and this is very much to be avoided naturally. Irritability or depression and nighttime awakenings, maybe even sleepwalking. Not all snoring is sleep apnea, but almost all sleep apnea involves some degree of snoring. The key is whether the snoring is loud and chronic and followed by breathing pauses or choking sounds. People with sleep apnea often don't remember waking up, but their partners do. The poor partners. And because the interruptions fragment deep sleep stages, you can sleep for 8 hours and still feel like you got hit by a truck. Daytime sleepiness is a huge red flag. Falling asleep at work, in meetings, or worse, in traffic can be a sign your body is desperate for real restful sleep. Diagnosing sleep apnea starts with just recognizing the symptoms. If somebody comes with one or more of the above symptoms I've just discussed, there's your key already from the get-go. But the gold standard to diagnose this problem is, of course, a sleep study, also known as polysomnography. You can do this in a sleep lab where you're monitored overnight for breathing patterns, oxygen levels, heart rate, and brain activity. Increasingly, though, there are home sleep apnea test kits that you can either borrow from your general practice or from any lab, and you can do this at home. The key metric here is the apnea-hypopnea index, the AHI index. Normal range is fewer than 5 events per hour. Mild sleep apnea is where you have between 5 and 14 episodes of sleep apnea. Moderate 15 to 29, and severe is 30 or more. Remember, this is per hour. So that's quite a lot, 30 or more. That's basically every 2 minutes. That's pretty bad. Your doctor, of course, may do a physical exam of you, checking your airways, your breathing apparatus, listening to your lungs, etc. You may have to fill in a sleep questionnaire, the most famous of which is the Epworth Sleepiness Scale. Your doctor will, of course, also listen for your heart rhythm because often sleep apnea is related to other problems with the cardiovascular system, including blood pressure, of course, and we've talked about this before, atrial fibrillation. blood work to rule out other related conditions, to rule out other causes of fatigue and sleepiness. For example, iron deficiency may also be done as part of your workup. Getting diagnosed is crucial. I can't stress this enough, because untreated sleep apnea doesn't just affect your nights, it destroys your days too, and it kills you either directly through the illness itself, or it kills you because you kill yourself on the road because you're driving when you're not fit to drive. And of course, you are at risk of killing others. Goes without saying. How do we treat this condition? Well, lifestyle changes. As ever, you need to lose weight if you're overweight, especially for men who have thick necks because of obesity. This applies to women, of course, but because women in general are much smaller and lighter than men, all things being equal, of course. This is a particularly prudent way to deal with this problem long term. Exercise not only helps you to lose weight, it also helps you to condition your body better, regulate your breathing, etc., reduce the risk of hypertension, and of course also atrial fibrillation. Avoid alcohol and sedatives. We've talked about this, especially just right before bedtime. Sleeping on your side also helps, because it helps to reduce the airway collapse that happens in some patients with sleep apnea. The mainstay of treatment is, however, CPAP, continuous positive airway pressure, CPAP, and this is the machine, the breathing machine that people wear or have to, attach themselves to during sleep to help regulate their airway pressure, so that they are able to prevent the airways collapsing and preventing the gaseous air exchange, so oxygen in and carbon dioxide out. And basically, it's a machine that helps to relieve symptoms, improve your sleep quality, although some people may argue that it actually decreases sleep quality, but I think it's just it's more a user problem than otherwise. The downsides, yes, it can be uncomfortable or noisy, and if you have a partner, that partner might well have to sleep in another room, but this may be temporary. There are, of course, other devices you can use. There are certain dental devices you can use to pull your jaw forward to keep the airway open, but this is only best for mild to moderate sleep apnea or those who can't tolerate CPAP. There are some surgical procedures you can do, of course. One is the uvulopalatopharyngoplasty, which removes tissues in the throat and neck area to basically lessen the tissue load over there, which is often a problem for causing blockages that obstructs the airflow, basically. Tonsillectomy, especially in children, can help. There is an implantable nerve stimulator which can also be implanted, and this helps to open the airway with each breath. Positional therapy is another thing that can be done to help. Now, we've talked about this in a small manner, and that's where people lie on their side. You could also use special devices or alarms that help to keep you on your side, because of course during sleep you don't have any kind of control over your own position, right? These devices include like tennis balls and wedge-shaped cushions and pillows that you can apply to your body or on your bed, so that you're able to stay on your side. So the issues with sleep apnea, of course, are historical. In one of my old videos, I even mentioned the Pickwickian syndrome. Pickwick was a character in, I think it was Great Expectations, the book by Charles Dickens, British or English author. Now, it's getting more and more common in this day and age because of obesity, And also because we all live a little bit longer than in previous years. So yeah, it's a big factor. Can it be cured? Sometimes, especially when combined with weight loss, either naturally or with weight loss surgery. But many people just have to live with it. Yeah. Can you use mouth tape or nasal strips? These may help snoring, but not really substitutes for the medical treatments. Yeah. So, and yeah, very important. Is it dangerous to leave it untreated? Absolutely. You risk heart problems, not only risk of stroke and all that, but also accident rates go up with sleep apnea rates. So, yeah, that's possibly a good motivation to have it treated. And of course, you disturb your partner's sleep. So that's another altruistic reason to have your sleep apnea treated if you have it. So, what happens if you never sleep again? The short answer, you fall apart. Mentally, physically, emotionally, you unravel. And eventually, you die prematurely. Sleep is not about being lazy. Sleep is not optional. It's one of the most important things you can do for your health. So tonight, get your 7 to 9 hours of sleep. Your brain will thank you. Your body will hug you. And for the future, your body will definitely be grateful. If you found this rather horrifying but useful, I hope, video helpful, don't forget to like, subscribe, and hit that bell icon for more real medical breakdowns here on Askadoc. Now go to bed. Seriously, doctor's orders. But if you must stay awake for a while longer, okay, you may do so, but use the time wisely. Ask me something. Go on, Askadoc.